Good morning, sir. Today I'll be presenting about my individual assignment for abnormal psychology. The topic chosen is major depression, major depressive disorder. So, what is depression? According to APA 2013, major depressive disorder or depression is a serious or a severe psychological illness that will affect your feelings, emotion, and behavior negatively. So, to be diagnosed to be diagnosed with depression, you need more than 5 symptoms in the criteria, and the symptoms must last more than 2 weeks. And the individual must be achieve the 4 criteria of DSM-5, which there should have no manic, mixed, or hypomanic episodes. They are not due to medical disorder or other substance. They are not due to schizoaffective disorder. Ultimately, these episodes causes impairment or dysfunction in social or occupational. So, major depression disorder has an estimated lifetime prevalence of 10% in the general population, and the prevalence will be higher when it is clinical setting. From the report from WHO, they found out that more than 260 million people are suffering from depression until 2017. So let's go into our case study. Okay, before go into our case study, this is the symptoms of DSM-5: feeling sad or depressed, insomnia or hypersomnia, anhedonia, which no pleasure, no interest of anything, weight loss or gain, psychomotor agitation or retardation, fatigue, feeling of worthlessness or having excessive guilt, low concentration, thoughts of death or suicide. So this is important criteria that I mentioned just now that must be met by the individual to be diagnosed with DSM-5. So a background information of the case study. So the case study is a female individual who is 40 years old, a Malay Muslim. She worked as a housewife. Her educational levels are to secondary. She is living with her husband. One of her tragic is she has children. She has a youngest child who having learning disability. This will further may be a cause of her mental depression, depressive disorder. So the summary of the case study. So initially, the individual feel that she is depressive and she is unable to complete her tasks. Then therefore she consulted traditional, as their family is more religious. Then they are admitted to the psychiatric unit as she becomes psychotic, as she threatened her husband with knife unprovoked. So then she was diagnosed with MDD with psychotic features. However, in the meantime, she not able to fit into the medication pharmacotherapy that offered by the clinician. Therefore, after a few days, when she is becoming stable, she received religious counseling from a ustad, from a famous ustad in Malaysia. The religious counseling is named as Ruqyah Sharia. After a few years, she recovered from MDD and she able to function properly. She able to sleep well and do her tasks. Then, in 2015, she experienced relapse, which she diagnosed with MDD with psychotic features and even comorbid with GAD, general anxiety disorder. Then she is further receiving treatment for pharmacotherapy treatment again, and she received psychoeducation treatment, and her family members also received psychoeducation treatment also, which helped them to exclude the stigma because they believe that she is possessed by demon, because they are religious, because they are more believe in Islam or those belief. in demonic possession. So her mental health assessment. The patient was diagnosed with MDD with psychosis. She experienced relapse and diagnosed with MDD with psychosis, maybe GNAD. Then she released medication and religious counseling. This is what she had undergone. She made DSM-5 criteria of having. She met the 4 criteria, and she have more than 5 symptoms, which is constantly sad, insomnia, feeling worthlessness, low concentration, recurrent thoughts of death. Her psychotic features is due to inappropriate traditional treatment. She also reported that she had panic attacks, and at the first clinician diagnosis, she is not diagnosed with any specifier of anxious or with anxious symptoms. So the study will be offering this intervention plan to help her initially deal with her symptoms, because after dealing her symptoms she able to perform stably, then deal with her grief and stigma. The study want to deal with her grief and stigma because initially the case study, the clinician didn't deal with her grief, she failed to help or provide proper help for her youngest child, which has learning disability, and the family have very strong stigma against psychological treatment or psychiatric treatment, because they don't believe in psychiatric treatment, as they keep wanted to find other religious counseling to help her. Furthermore, develop social network. So the study found that the individual have very lack of friendship, and there is no social network between her life is just a child, her family members. So first and foremost, in the intervention 1, the aim is to deal with her symptoms. So first, the pharmacotherapy, the medication will be introduced to the individual to help her to become stable, as all these depressants help her to be in a normal state, help her physical health to regulate properly. So she able to sleep properly through benzodiazepine. She able to she be less depressed and able to communicate properly with through the antidepressants. Then religious counseling is introduced, as she may refuse to consume the drugs, and religious counseling will help her or give guidance to her that counseling and combination of pharmacotherapy will help her to become more believe in psychiatric treatment. Furthermore, family and peer support. Family and peers are very significant for her, as she is very weak mentally and physically. The family members like husband need to give support at most of the time, as this will prevent her from relapse and will benefit her socially. This mental support will help her to have confidence that she will recover, and she is not fighting this disorder alone, and she is fighting disorder with her family and her peers. So intervention 2. A study will introduce psychology sessions like using CBT and combining with religious counseling, and furthermore psychoeducation to deal with guilt and stigma. She is not access in the case study, she's not treated with any psychotherapy. So I think CBT will help her to change her negative thoughts and therefore shift to a more positive side, and he able to process everything, stress, issues, relationships in a more positive manner. Therefore, she able to manage her emotion, process emotion in a more appropriate way, which she understand that depressed is not a bad feeling, but it's an express of emotion. Then religious counseling is to help her to, as religious counseling is more suitable for the client as she's religious, Therefore, she have more confidence in the treatment, and she able to attend every treatment for the session. Therefore, she can improve more better, and she will not being cut off or not cut off. She will drop off from the psycho, psychological treatment session. So last but not least, psychoeducation. Psychoeducation is help her to deal with the stigma, not only the patient stigma and also the family member stigma. Therefore, this will help her to have confidence towards the medical team and reduce the stigma over psychiatric illness, and believe that psychiatric illness is not a really big problem and it can be treated. So another intervention is to help her to develop social networks. So the study will be assigning her tasks like meeting new friends, while going to the mosque or going to prayers. She will give her appraisals when she complete the task. When she able to communicate properly, you give her appraisals, cognitive appraisals, like you did well and something like that, and promote her to process emotion properly, like express emotion in a more proper way, telling that he's not feeling good, and etc. The treatment rationale. Okay, that's all from me. The treatment rationale is the study using CBT plus second generation antidepressant vancomycin second generation antidepressant to help her, because the study believes that this will help her. CBT will help her to develop new coping skill and process her inappropriate cause or irrational cause properly, and therefore she process her emotion better, and etc. For pharmacotherapy, it just help her to become more stable and is effective with when it's paired with psychotherapy. However, the study believes that there is no most suitable treatment for a patient, because every individual is different and treatment plan is tailored for the individual. So maybe CBT is not suitable for the study, but I think it is the most efficient way that is found with most empirical evidence. That's all from me. Thank you.